So Enhertu or trastuzumab-deruxtecan is an antibody drug conjugate. So it's got the trastuzumab antibody to bind to HER2, and then it's got a very potent topoisomerase 1 inhibitor attached to the antibody. And so that's kind of like irinotecan, but much more powerful and much more active on a cellular level. So there was a randomized phase 2 study done in Asia that will be repeated in the US as a phase 3 trial. But these data were pretty impressive. There were 187 patients randomized to either in a 2-to-1 design of the antibody drug conjugate in HER2 versus MD choice of chemotherapy. And the response rate for the antibody drug, and these were patients who had all received trastuzumab previously and at least 2 regimens. So the response rate was 50% for Enhertu and only 14% for the chemotherapy arm. And so that was very, very impressive. And the hazard ratio for PFS was about 0.5 and about 0.6 for overall survival. So it looked like giving an antibody drug conjugate in third-line treatment of gastric cancer that was HER2 overexpressing really had tripling of the response rate and doubling of the PFS and overall survival, more or less. So that's a super promising drug, and we know it's also been approved for breast cancer, so it seems like this could be a breakthrough drug for HER2 overexpressing gastric cancer going forward.